Now to the battle over mask mandates on public transportation. The Department of Justice says it is appealing a federal judge's ruling which brought a halt to the CDC's mask mandate for travelers on most planes, trains, and buses. The DOJ says the decision to appeal was made in part to preserve that authority for the CDC to have in the future. CDC believes the mandate is still necessary for overall public health. The agency originally extended the mandate to May 3rd as it continued to look at data from the most recent BA2 subvariant. Former FDA Commissioner Scott Gottlieb says we may be close to seeing the BA2 wave slow down.
At this point, I think we can lift the mandate. I'm not surprised they extended it out a couple of weeks. We're in the setting of a surge of B2 infection right now. It's regionalized. It's mostly in the Northeast and Mid-Atlantic, some parts of Florida. I suspect we're much deeper into that surge than we know because we're not measuring all the actual infections that are occurring. I suspect we're only capturing 1 in 7 or 1 in 8 infections because a lot of people are either testing at home or not testing at all. And I think this is going to be over sooner than we think. I think we're much deeper into this surge. So 2 more weeks, things may look much different in terms of the pace of the infection here in the U.S.
The mask mandate will not be enforced as the DOJ moves forward with its appeal, but new polling suggests 56% of people are in favor of the mask requirements on public transportation. Many of those people plan to keep wearing those masks despite the ruling. Dr. Tina Carroll-Scott joins us now with more. She is the medical director at South Miami Children's Clinic. Good to have you with us. So that poll tells us the majority of people think we should keep the mask mandates, but many also celebrated the decision to drop the masks, saying it was a long time coming. How difficult do you believe it's going to be to have people put masks on if, say, that decision is reversed or they need to come back for any reason?
So I think it's actually going to be very difficult. You know, it's sort of like trying to put the genie back in the bottle. And, you know, I think the debate around the mask has been one of the most disappointing aspects of this pandemic and how it's become so politicized. And masks really have been an important part of our mitigation efforts over the last 2 years and helped to drastically reduce the spread of this virus. And, you know, regarding airplanes, although planes actually have a great filtration system and more people are vaccinated now, no mitigation measure by itself is perfect. And so the more layers that we add, this Swiss cheese approach that we've talked about throughout the pandemic, will add an extra layer of protection when it comes to reducing transmission, especially on an airplane. And, you know, we also need to remember that we still have lots of people in our community who are high risk for a variety of reasons and remain vulnerable, you know, even if they're fully vaccinated and boosted. And we still have a huge subset of kids under the age of 5 who aren't even eligible yet. And so, you know, I think it's easy to only consider our individual risk when deciding whether to wear a mask. But I think we have a responsibility to protect all of those around us as a member of a society.
You know, I remember 2 years ago, early in the pandemic, when we were wearing masks, we were told, my mask protects you, your mask protects me. So I still have that on my mind when we think about people who are not comfortable traveling without a mask. I mean, how much does my mask for me, how much protection does that offer against COVID if no one else around me is wearing one?
So I think masks still provide protection, even if others around you are not masked. And definitely wearing a high quality mask, such as an N95 or KN95, provides substantially more protection. So I think something is better than nothing. But the ideal situation is if others around you are masking as well. If we have, you know, two-way masking, especially in enclosed spaces, without the ability to social distance.
And finally, doctor, you know, among those who are most worried, you mentioned it, it's parents with kids under 5 and immunocompromised people and their families. Do you think we are doing enough to protect vulnerable people, especially those who are immunocompromised?
No, I actually don't. And, you know, as I stated before, you know, we have a huge subset of children under the age of 5 who aren't even eligible to be vaccinated yet. 18 million children actually under the age of 5. And as a pediatrician, it saddens me that it seems like we've just forgotten this population as we go back to life as normal. And although children have fared well throughout this pandemic, when it comes to not getting severely ill or dying, you know, we've had 400 children younger than age 5 who have died from COVID since the start of this pandemic. And, and I think we've yet to see what the long-term effects of this virus will have on our kids. So although I know in many areas across the U.S., it looks like this pandemic is over, it really is not. And, and it's not over, especially until we get the youngest of kids the opportunity to be vaccinated, and really the rest of the world.
Dr. Tina Carroll-Scott, thanks so much for joining us this morning. We appreciate it.
Thank you.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.